Prime Minister Narendra Modi inaugurates the Bengaluru Tech Summit virtually. COVID-19 vaccine will be available in a couple of months, says Health Minister Dr. Harsh Vardhan. COVID-19 recovery rate in the country improves to 93.58%. Centre deputes team to Manipur to stem the spread of COVID-19. Teams also earmarked for Haryana, Rajasthan and Gujarat. And secondary school leaving certificate and HSSLC exams in Meghalaya slated for March-April 2021. Good evening and welcome to the Northeast News. This is Jushna Borua with the news in detail. Prime Minister Narendra Modi inaugurated the Bengaluru Tech Summit virtually today. Speaking on the occasion, Modi explained the possibilities of technology in taking the benefits of governance to the last man in society. Technology speeds up delivery of government programs and encourages transparency, Modi said. May it be the world's largest health insurance program, Ayushman Bharat, or reaching electricity and providing shelter to the poor and downtrodden, the Prime Minister said the policy of his government is to find tech solutions for their quick implementation. Asserting that technology has changed the life of the common man for the better, Modi spoke about the UPI digital platform Swamitva Yojana to provide land titles in rural areas and Digital India program. The summit, to be held for 3 days starting today, will see participation of 4,000 delegates and 270 speakers in 75 panel discussions. 25 tech nations are joining the summit along with thought leaders, industry captains, technocrats, researchers and innovators, among others.
Any regular government initiative, Digital India has become a way of life, particularly for the poor, marginalized and for those in government.
Health Minister Dr. Harsh Vardhan today announced the government's decision to introduce a new category called Wards of COVID Warriors in the guidelines for selection and nomination of candidates against Central Pool MBBS seats for the 2020-21 academic year. 5 Central Pool MBBS seats have been reserved for this category, even as the selection of candidates will be made by the Medical Council Committee through online application on the basis of rank obtained in the NEET 2020 conducted by the National Testing Agency. Stating that the move aims to dignify and honor the noble contribution made by the COVID warriors in the treatment and management of COVID patients, the Health Minister said the Central Pool MBBS seats may be allocated for selection and nomination of candidates of COVID warriors who lost their lives battling the pandemic or died accidentally on account of COVID-19 related duty. The minister announced that the definition of a COVID warrior has been laid down while announcing the insurance package of 50 lakh rupees. He added that COVID warriors are all public health care providers. Health Minister Dr. Harsh Vardhan has expressed confidence that COVID-19 vaccine will be made available to the people of the country in a couple of months. Speaking at a FICCI program virtually, Dr. Vardhan said a tentative guideline has been planned for the distribution of vaccine. He said after the corona warriors, vaccine will be administered to the persons who are above 65 years of age. Dr. Vardhan said that an estimated 400 to 500 million doses of the vaccine will be available by July and August next year, which can be administered to 30 to 35 crore of people initially. The COVID-19 recovery rate of the country has further improved to 93.58%. More than 83 lakh 83,000 people have recovered so far. In the past 24 hours, 48,493 recoveries have been reported across the country. Ministry of Health in a statement said daily trend of recoveries has outpaced new cases, ensuring continuous shedding of active caseload, and the active caseload has fallen below 5% of the total cases. The active cases currently comprise only 4.95% of the total positive cases, and the total number of active cases in the country is 4,43,303. The Health and Family Welfare Ministry today said a total of 45,576 new cases of COVID-19 have been reported in the country within the 24 hours. In one day, 585 deaths have been reported, taking the nationwide toll to 1,31,578. Even as certain parts of the world have reported a surge in COVID cases, especially the United States and some European nations, Assam leads the COVID tally in active cases in the northeastern region. With 3,285 cases, the number of the discharged cases account for 2,66,011 cases. The tally for the dead is 969. Close on the heels of Assam is Manipur with 2,828 active cases and 19,259 cured cases. The death toll is 231. Nagaland follows with 1,255 active cases and 9,057 cured. The dead number 54. With 1,182 active cases in Arunachal Pradesh, the number of discharged in the state has reached 14,715. The death toll has touched 48. Meghalaya comes next with 753 active cases, 10,014 discharged cases, even as the tally for the dead is 103. Violently battling the COVID pandemic within the months following the outbreak of COVID, Mizoram has 487 active cases, 3,021 cured cases, even as the death toll has topped 5 cases. With 300 active cases, Sikkim has 4,182 cured cases, even as the tally for the death stands at 95. Health Minister Dr. Himanta Biswa Sarma in a tweet said that 169 cases were detected yesterday out of 23,484 tests conducted with a positivity rate of 0.72%. The minister condoled the death of COVID patient Loknath Gogoi, 62 of Tinsukia, Anasur Haq, 14 of Kamrup Rural, and Moinul Haq, 52, also from Kamrup Rural. Ravaged by the COVID-19 pandemic, the world is all set to reinforce their efforts to stem the spread of the pandemic that has turned the world upside down. The total number of coronavirus cases has topped 5,62,183, even as the cured cases have reached 3,94,15,064. The tally for the dead across the world stands at 1,35,05,875. Centre has deputed high-level central teams to Haryana, Rajasthan, Gujarat and Manipur to assist the states in reinforcing containment, surveillance and testing. With the surge in daily new cases and the spike in daily fatalities in Delhi, the spillover effect is being observed in the national capital regions within the state of Haryana and Rajasthan, where the number of COVID-positive patients is on the rise. Leading the 3-member team bound for Haryana is Director, All India Institute of Medical Sciences, Dr. Randeep Guleria, while Member Health Niti Aayog, Dr. V.K. Paul is heading the Rajasthan team. Director NCDC is slated to lead the team to Gujarat, even as the team heading to Manipur is being led by additional DDG DHGS Dr. L. Swasticharan. The teams will visit districts reporting a high incidence of COVID cases and support the state efforts towards enforcing containment, testing, infection prevention and control measures and efficient management of positive cases. Time now for a short commercial break. More stories to follow. Stay tuned.
अरे वाह, लेजेंड की बैट, इससे तो मैं खेलूंगा। फ्यूचर बैटिंग लेजेंड बैट।
इसमें जिसका नाम लिखा है बैट उसी को मिलेगी।
अरे यार,
देखा, अगर इस पे मेरा नाम नहीं लिखा होता तो कितनी दिक्कत हो जाती। इसलिए आरबीआई कहता है बैंक अकाउंट हो या बैंक लॉकर, उसमें नॉमिनी का नाम जरूर दर्ज करें ताकि आपकी जमा पूंजी उसी को मिले जिसे आपने नामित किया है।
आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
Welcome back. Today is World Toilet Day. This day is being observed to create awareness about sanitation and encourage people to use toilets. Department of Drinking Water and Sanitation of Ministry of Jal Shakti will celebrate World Toilet Day under Swachh Bharat Mission Gramin for promoting awareness on access to safe sanitation. On this occasion, Jal Shakti Minister Gajendra Singh Shekhawat will felicitate top districts and states with Swachhata Puraskar. Vice President M. Venkaiah Naidu said poor sanitation leads to malnutrition and increases the risk of transmission of diseases. He said that hygiene and sanitation should be a priority for healthy communities and healthy nations. Prime Minister Narendra Modi said that on the World Toilet Day, India has strengthened its resolve of toilet for all. In a tweet, Modi said that the last few years have seen an unparalleled achievement of providing hygienic toilets to crores of Indians. In Meghalaya, the Secondary School Leaving Certificate and Higher Secondary School Leaving Certificate examinations of Meghalaya Board of School Education will be held in March-April 2021 because of the prevailing COVID-19 pandemic. The dates of examination will be finalized by the Meghalaya Board of School of Education. No selection test will be held for appearing in the SSLC and HSSLC examination. As a one-time exemption, all candidates who are willing to appear in the SSLC and HSSLC examination 2021 but had failed in selection test conducted in the year 2019 will be allowed to appear in the final SSLC and HSSLC examinations to be held in March-April 2021. It was informed that the current notification may not be treated as precedence. In Meghalaya, veteran journalist and Padma Shri awardee Patricia Mukim resigned from the Editors Guild of India yesterday over its silence on her case and alleged that the guild defends only celebrity journalists. In her resignation letter addressed to EGI President Seema Mustafa, Mukim alleged that the guild deliberately ignored her plea concerning the recent order issued by the High Court of Meghalaya refusing to quash a police complaint against her for her Facebook post on the July 3rd incident at Losotun in Shillong. The High Court had recently rejected Mukim's petition and said that the investigation agency should be given a free hand in probing the matter. In her resignation letter, the Padma Shri maintained that she no longer wants to be part of the group of editors whose loyalties are allegedly to those that occupy a certain elite space. You can also watch our bulletins and other programs on our YouTube channel DD News Guwahati. Before taking leave viewers are reminded to maintain physical distancing, frequently wash hands with soap and sanitizer, and don't forget to wear mask properly. Mask Up India.